and we'll start in about 3 minutes. Thank you. All right. Thank you for joining us today for another SCDN webinar. I just want to let everybody know your feeds are currently muted. So that doesn't mean we don't want to hear from you. That just means that if you have any questions during my presentation or during Allison's or Janine's presentations, please just write a note in the chat window, and we'll let the speaker know that there is something there to say. If it's something that is not of immediate concern, you just want a general question, just write the question and we'll get to it at the end of the presentation. If it's something that you want an immediate response on, let them know that you want an immediate response, and then we'll try to get the person's attention and make sure that they can answer you right away. So today's webinar is presented to you by Sustainable Pittsburgh and the Local Government Academy in collaboration with CCI, Conservation Consultants Incorporated, correct? And we're happy to have everybody here today. First, we'd like to also make a little note, and I'm going to try to do this at the beginning of every one of these webinars now, and that is congratulate the latest certified sustainable community, and that's Meadville, who just achieved gold certification. So good job to you guys, and thank you if you are able to join us today. And so I want to take a brief second to explain to you what the Sustainable Community Development Network is, and to talk about some upcoming events that we have. So if you, I got to flip myself. You got, okay. The network is designed to support professionals who work or are appointed to or elected to represent municipalities around the region or community development organizations. The network aims to support your work by providing access to local and national subject area experts like we are today, learning and networking opportunities with high-performing peers in the region, and by providing you regular written feedback or written letters such as our Sustainable Community Development Network email or newsletter. So we hope that you're taking advantage of those network resources. And I wanted to bring your attention to two upcoming events, and that is next month. There is another webinar that we're doing with LGA that's for the Age-Friendly Communities Plan that was just developed in collaboration with some work with the World Health Organization, Allegheny County, and a number of stakeholders here in the region. So that should be a very interesting webinar if you want to prepare for, there is a population bubble happening of people that are over the age of 65. And if your community is experiencing some of that, this is some great opportunity to prepare your community for those changes and to prepare your community for people of all ages. So look forward to that. And then we're also excited to announce that on April 3rd in Collier Township, we're going to be having a forum on how to find funding for renewable energy projects and energy efficiency projects for your municipality, for your authority. And we're specifically trying to get as many authorities to participate as possible because they are the largest, typically the largest consumer of energy in a given region. And then also the community development orgs, we hope to participate in that as well. And that's on April 3rd, 8 a.m. to noon in Collier Township at their municipal building. We also have Sustainable Pittsburgh has several other performance recognition programs that are excellent opportunities to enhance sustainability, create more vibrant communities, like the Sustainable Small Business Designation Program and the Sustainable Pittsburgh Challenge, which I know 25 municipalities signed up for it this year. We have 150 participants across all types of organizations, and it's in its fifth iteration, and we're excited about the competition is already fierce. People are already submitting actions and getting stuff done, so it's great. And then also, where there's clear policy issues, this network wants to support you on that. So if there is issues that you are having with your municipality in terms of sustainability, please reach out to us. We're happy to try to support that. We have SCA fellows that can do research. We have partnering organizations like we hear today that maybe want to hear this message. So please let us know, and we'll do the best to get the information to the right people or get you the right information. So I'm going to switch to the next slide here. I'm going to talk very briefly, and then I'm going to hand it over to Allison and Janine, and that is the Sustainable Pennsylvania Community Certification has a number of areas where they deal with healthy buildings and healthy community in general. And a few of those things are that municipalities should have programs working collaboratively with other types of organizations that address community health concerns, such as the programs that CCI does around the region. And we also encourage a number of different things that work with creating more sustainable neighborhoods, such as it's a good idea to map and plan and have a plan in place to mitigate blight. It's a great idea to have adopted the International Property Maintenance Code and to have adopted the Uniform Construction Code. But what we're going to discuss today, I think, is also going to indicate that maybe in a number of cases, we need to go a little further than those, especially when we're dealing with some of the older building stock that we have here in the region. And with that, I'm going to turn it over to Janine Zappa, who is the Executive Director of, I hit the wrong button. Okay. The Executive Director of CCI. So with that, Janine, I'm going to slip past you.
So thanks, Jim. Am I good?
You're good.
All right, so thank you, Jim. Thanks to Sustainable Pittsburgh. Thanks to the local government academy. I'm Janine Zappa. I'm the director at Conservation Consultants, Inc. We're a nonprofit. We're based on the south side of Pittsburgh, and we're happy to be celebrating 40 years this year. You can just move along to the next slide. Just real briefly to tell you a little bit about us. That's not, is that the first one? And then you put mine in after that. Okay, let's keep going. So CCI, as I say, is based on the south side. We visit over 4,000 homes every year. The organization focuses on energy efficiency and home health. And we really do three things. We provide technical expertise, and that means we go into homes and we actually do assessments and then help people to fix things. And we see a lot of stuff in the context of that. And we do education and advocacy. We can move on to the next slide. And so you'll see a thermographic image here. This is something that is probably easiest to explain to folks. This is one of the things we do. And in your house, we really are trying to deliver what the Department of Energy likes to describe as a high-performing home. And that's a home that lives better and lasts better. And so today we're going to talk mostly about the lives better part, because of going into all of those homes, and primarily we serve lower income households. We see a lot of issues that are typical in this community, but they are, the trifecta of the fact that we've got this kind of topography that we have. We have a lot of older homes, as Jim noted, and there's a lot of moisture in this region. We have, as you know, in Pennsylvania, more waterways than any other commonwealth in the country, and we have steep slopes. We have all the stormwater drainage issues, and how does that relate to houses and health? We're going to get into that. And today's topics are mold, lead, and radon. We have programs at CCI. We cover a bunch of things. And in the context of this work, what I want to do is introduce the project that we're going to talk about today, which is the Case for Healthier Homes. Allison Steele, I'll be introducing in a moment, who is our Director of Advocacy and Community Programs. And Allison formulated a project that was funded by the R.K. Mellon Foundation and the Heinz Endowments, taking that experience of going into homes and saying, hey, look, we see a lot of problems that occur, and as we're tightening homes, we can sometimes make those problems worse. And how do we fight them? And that had led us, and what we'll talk about today is what we did, what we saw, and what that has led us to conclude and recommend to you as opportunities in your municipalities to make a difference. So, Allison, the floor is yours.
All right. Thank you very much, Janine. Thanks everybody for joining us today. As Janine mentioned, I'm going to be reviewing the Grassroots Green Homes program and what we did as a part of that. Is that animated or not?
No.
Oh, okay. So there are a couple things you're not going to be able to see because the slide has a couple different graphics that we're going to pop up and go away. But I can let you know that some of the issues that we are dealing with in the homes that we go into as part of all of our services at CCI, not just Grassroots Green Homes, but all of what we do, we see a lot of issues that are very common in our part of the country. Allegheny County, for instance, 82% of the homes that we have in the county were built before 1978, which is when lead paint was banned for use in residential buildings. So it's very common in a lot of the homes that we go into. Lead paint, people know that it's a bad thing. They don't necessarily know why. A lot of the problems that it can cause, especially when ingested or when lead dust is inhaled by children, it can cause developmental delays, reduced IQs, ADD, ADHD, and a lot of other issues. Some of the other problems that we run into, we are in a very high radon area. Allegheny County is actually designated by the EPA as a Zone 1, which means that any home is likely, statistically likely, above 50% to have a radon level above the EPA's recommended action level of 4 picocuries per liter. So that just means action level is 4. Most likely, homes are 50% likely to be above the action level of 4. Again, radon is one of the home health risks that has flown pretty low under the radar. People know it's bad. They don't necessarily know why. Long-term radon exposure causes lung cancer and actually is the leading cause of lung cancer among non-smokers. And in the U.S., there are more deaths per year caused by radon exposure and resulting lung cancer than drunk driving. Finally, one of the 3 issues that we're going to be talking about today is mold. Any home can be at risk for mold, and there are a number of issues that can cause mold within a home. It can result from roof leaks, poor foundation drainage, downspouts that aren't diverting water properly, that result in water incursion in the basement. It can also result from improper air sealing within a home. So if someone thinks their being responsible citizen and getting their home weatherized, but if it's not weatherized properly, if air gets trapped by someone who doesn't follow proper procedure for weatherization, that can cause mold as well. And then mold results in problems such as asthma, obstructive lung disease, lung infections. And as I said, any house can be at risk for mold, but it does disproportionately impact low income and minority households. And this top graph that you see in this slide has a list of the energy burden for various cities throughout the country, and Pittsburgh is actually right in here. So there is a very high energy burden for residents in this area. And that means a disproportionate impact of these home health risks as far as a large proportion of income going to pay for energy bills. So thank you. So what we decided to do with this information and these issues, we developed a program called Grassroots Green Homes that is focused on neighborhood outreach and education, helping neighborhood residents in specific neighborhoods to understand what the issues are around energy efficiency and also health within their homes. What we did was took surveys of all of our participants and gathered information on the age of the housing, the condition of their housing, asked participants to report on home issues that they saw on a regular basis. So drafts, leaks, peeling paint, concerns like that. And also radon. We actually found that most of our participants were not aware of what radon was or why it might be a problem. And that right there is a radon map of Pennsylvania right there on the top. And you can see Allegheny County is in the red in Zone 1. So it's a widespread problem across the state, but in our focus in work in Allegheny County, that's one of our top priorities. So what we were able to do in developing this report and set of recommendations called the Case for Healthier Homes was we took this information that we saw in our journey through the first round of Grassroots Green Homes, which was located in the neighborhoods of Oakland and Uptown. We took this information that we learned from the participants and also paired it with best practices around the country, and were able to develop a set of recommendations for the Pittsburgh area. And what we'd like to do, just to get started, is ask a couple of questions of the audience, just to help us understand who's listening in today, what kinds of questions we can answer. So the first question, if you can estimate the percentage of blighted or deteriorated housing in your community. And I believe it is up right now, and we'll give everybody a couple seconds to answer. All right, so we'll close the poll right now. And are people able to see the results as well? Okay, great. So let's move on to the next question. And so this one, if you're aware, does your municipality have a requirement for landlords to register their rental properties in a municipality-controlled database or repository. Okay, thank you, everybody. So it looks like it's about a third for each, with a little bit higher on the yes, which is good. It's nice to see that there is that opportunity for visibility within your municipalities. And so that brings us to the next question. What we would like to know is if you don't have this in place at the moment, would you like assistance in starting or improving a rental inspection program, or to be connected with other practitioners in that area? That looks about half and half. And for those of you who did answer yes, I believe we have your contact information tied to that, so we can get in touch with you after the presentation is over. So we're going to take a break from questions and go back to Grassroots Green Homes. After a year of doing community outreach and education, providing tools and tips for free to all of our registered participants, as well as deep weatherization and health services to a subset of our participants, we had some really impressive results. We found we did testing for mold, lead paint, and radon in all 20 homes of this subset called Weatherization Plus. And what we saw was we did find instances of mold in about a third of the homes, which matches up with our other programs. Anecdotally, we've seen mold or moisture issues in about a third of the homes we go into on a regular basis. We did have some high radon measurements before the weatherization. And as Janine mentioned earlier, these are things that you want to be aware of when you're going into weatherize a home. You don't want to seal up a home that has high radon or that has a mold problem, because then you can exacerbate the problem. So we did radon testing both before and after the weatherization work was done. There were 2 homes that the radon was high enough that we actually went in and installed a mitigation system. And so that brought those levels down as well. And then as far as lead paint, which is the column in the middle, you'll see that the vast majority of the homes, actually 75% of that set of homes, had lead paint. There were most cases it was encapsulated and not deteriorating, but there were 1 or 2 homes where we did have deteriorating lead paint. One of those homes had a number of young children living there, so we were able to connect that home with county resources. And Janine will go into a little bit more detail about those resources that are available later in the presentation. So given our findings and our research into best practices around the country and interviews with stakeholders in the area, we developed a white paper with this set of recommendations, and I believe we can put the poster up for download. So this poster that you're seeing on your screen right now is available for download, both right now in the webinar and on our website. There's a link at the bottom of this slide with a web address for our advocacy page at CCI, where you'll be able to see this poster, the full report, a slimmed down version of the report, and some other actions and information that are available to you as well. We also have a web address below that for the Allegheny County Health Department's led task force's recommendations. So there's a lot of alignment. We spoke with them a great deal when developing our set of recommendations. There's a lot of alignment between what the task force is recommending, what we're recommending, and work together with a large group of stakeholders to make sure that we were being considerate of the issues that Pittsburgh and Allegheny County face. We are going to go into a little bit of detail coming right up about some of the things that were successful, programs and policies successful across the country that could work in Pittsburgh, either directly adopted or adapted to this area. So if we want to move on to the next slide, and would it be possible to put the slim version of the paper up for download as well? Thank you. So just a quick high-level overview of what we're recommending. There are 5 different action areas. So the first one, we want to make sure we're protecting children from these health risks. And that involves investigating all instances of elevated blood lead levels in children, demanding resources for targeting hotspot neighborhoods where we know lead paint to be a problem, and safeguarding places where children gather, such as public playgrounds, daycares, other areas like that. The next recommendation is protecting people who rent, and that involves establishing all rental units, including Section 8 housing, as healthy homes, making sure that there are those safeguards there. Confirming lead-safe construction and demolition practices are being followed. And also, we had the question about the rental registry earlier, engaging landlords to take a voluntary healthy home pledge and getting them involved in this process as well. Our next recommendation is declaring healthy homes a public health policy priority. That includes fixing homes and apartments that pose health risks from lead, mold, and radon, leveraging synergies between city and county efforts, making sure that all of the organizations focused on these issues are working together as effectively as possible, and involving the medical community to assist in best practices and data tracking. Next recommendation is arming the public with access to information, and that includes posting easy to navigate home health data on the county health department website, boosting disclosure information at the time of sale or lease about any issues that may be present in the home or apartment, and also to coordinate ongoing education and support opportunities for residents, trainings, resource availability. And finally, our last recommendation is to guarantee goals through monitoring and reporting. We're going to be doing all these things. We want to make sure that they're making a difference. So this involves expanding support to at-risk homes through a cross-functional network of organizations, creating a county-wide rental registry that has information on testing, remediation, and compliance, and also publishing an annual Healthy Homes scorecard. So what we can do next, we have a couple more questions before we dive into the details on some of these recommendations, and this will help us get a sense of where each of you and your municipality stand. So the first question that we have, if you know, does your municipality have requirements for radon-resistant construction in place currently? Okay, thank you, everybody. It sounds like, for the most part, people are saying no or they're not sure. So thank you for that. We will move on to the next question. And this one is related to lead practices. So if you know, does your municipality require landlords to test for, contain, and disclose lead paint hazards? Okay, thank you very much. Looks like we do have a couple yeses, but largely no, and I don't know. Moving on to the next question. This is going to be radon related. And so, to the best of your knowledge, does your municipality require landlords to test for, mitigate, and disclose radon hazards?
You're back home.
Okay, thank you. It looks like most people have answered no, some I don't know, and at least one yes. So moving on to the last question that we have. This is going to be moisture and mold related. Does your municipality require landlords to test for, mitigate, and disclose mold hazards? Thank you very much. That looks about the same as the radon. We've got a lot of no's, some I don't knows, and a couple yeses. So at this point, I'm going to hand the presentation back over to Janine, and she is going to go into detail about some of the case studies that we saw for best practices around the country.
Okay, so as Allison explained, these are three really critical issues in our region. And one thing I want to emphasize is these are preventable public health issues. And it looked like 25, amongst the poll question, the first one about how much of your community is blighted, the largest answer block, to remind you, was 25% or more. So for the people on the call today, you know, you deal with these issues. You're well aware that deteriorated housing has a very strong connection and correlation to these kinds of problems in the home. So that's the discouraging part. But the good news is that other people around the country also face these same challenges and have found ways to come at this from a policy perspective. So we're going to highlight three different regions. These are not the only ones. All of this is in the paper that you can download that Allison just pointed you to. So let's start with Montgomery County and Baltimore, Maryland. Baltimore is a city that has conditions that are very similar to our region in terms of housing stock being old, lead paint problems. And what they have done is implement, as of October 2016, all homes must be tested for radon prior to any real estate transaction. And while that is commonly done here, it is not legally required. Just to remind you, since 1995, all homes built in the county must adhere to radon-resistant construction standards, meaning that for a new home, you're going to need to put that kind of passive radon mitigation system under the floor because it's a naturally occurring soil gas. You can't do anything about it, but you can prevent the problem of radon in the home from building up. A couple of things about Montgomery County is, so they decided to go, a little bit further than what was required by offering these. They offered low-cost radon test kits, which are typically funded by an EPA grant through local public health departments. But Montgomery County, went a step further, expanded the definition of indoor air pollutants. And so they, as it's noted here, indicated that air pollutants included dust, odors, viruses, bacteria, fungi, radon, asbestos, smoke, gas, and mold into their DEP guidelines, and they give a very clear definition of indoor air pollutants. So that's one of the first steps that you can take toward comprehensive action to address these things. They enforce those indoor air quality provisions, and then they have two individuals who start with a warning letter from the DEP, and they have penalties of up to $500, which increase to $750 for repeat offenders. So that's one approach they are taking. They also have focused on lead paint, giving it equal importance and backing it by a powerful state law. They have a law in Maryland that requires that property owners submit a lead poisoning prevention checklist annually. Annually, I'm going to emphasize that, in addition to obtaining a lead paint inspection certificate. And it falls into 5 categories that aren't detailed here on this slide, but basically, first, the building could be certified as lead-free, and then you only have to do it one time if that building is truly lead-free. If it's registered as limited lead-free, it has to undergo a reinspection every 2 years from the date of the first inspection to be reclassified. So there's, kind of a protocol there in how they do it. But I just wanted to share with you, there's a full risk reduction category. Properties must have a dust inspection test at the change of tenancy, but preferably in a vacant unit before occupancy. And then there's a modified risk reduction, and there's a lead safe designation. So I won't go into the details on each of those, but you can look it up in the paper. But the point being that you can create kind of a hierarchy of how you want to enforce this. One of the most interesting things that Montgomery County has done is create a database that lets prospective tenants check if an apartment or home has an outstanding violation that has not been fixed. So you have information. It should be publicly available. The more that you're able to empower those prospective renters with that information, they can be part of the change by simply choosing. And I recognize that there are challenges in that, and we're not blind to it, that many lower income individuals who may be renting some of these properties that are potentially in the worst condition in your community may not always have choice. So that's where you come in with better policy of helping them. As Allison noted, children and renters were high among our recommendations because they're really critically vulnerable populations who are most frequently impacted by these issues. We'll take a look at Burlington, which I think is a really positive and exciting story, because in our research, we found that they basically told us that it took a little over 12 years for them to basically make lead poisoning a thing of the past. And I know some of you sitting out there are probably saying, I don't believe it, that'll never happen in my community, but they certainly had significant problems there as well. And so what they've done is really focus on taking their Section 8 housing voucher program and requiring an inspection, which is also, if somebody fails a lead paint inspection here, it is required here, but there's a lot of lack of clarity about kind of how that then unfolds and what happens next. So I think there's opportunity there. So in Burlington, then the landlord has 30 days to fix it before the agency withholds rent. And then they will have to deal with city fines on top of that. They have found that that gets landlords moving. And I don't want to suggest that all landlords are negligent. They are not. But for those who are, you have an opportunity to push them down the path of doing what they should be doing. And for you to be able to help to fund the enforcement that you will need through those fines. So that dovetails with their public health authority, and their code refers clients to their lead hazard reduction program, but docks their loan forgiveness rate for not being code compliant in the first place. So they're really trying to use the power of the purse in how they influence those landlords. They've also engaged their Women, Infants, and Children Supplemental Nutrition Program. The state public health department that cares for 50% of Vermont's children has access to the lead screening data of their clients and makes calls to the housing authority when they see a red flag. So they have found a way around what has been presented here as a potential HIPAA issue. So I think that there is a way for you to take information that is coming from lead level tests of children, from those who are seeing those, to be flagging your housing authority, and potentially vice versa. And we've been told by local agencies that there's a gap there, and we want to pinpoint that as an opportunity for you. In that state, the Attorney General doesn't flinch at prosecuting. So those are some of the biggest things, and really just that these code enforcement officers receive a lead assessment training. So that's one way to broaden the skill set of those who you already have out on the street doing work on your behalf, so that they can be doing that. Some of you may already be doing it. If you're not, we'd encourage you to consider that. Let's take a look then at Boulder and Longmont. So Boulder, Colorado doesn't seem to have the lead paint issue that we do in this region, but Boulder County and Longmont, Colorado have done some really interesting things in trying to get really strong collaboration. They have a lot of unincorporated land there, unlike here. And so the county in that instance has a very significant presence. So the county doesn't aggressively pursue lead. As I noted, it's not really as much of an issue there. And that's what that first bullet point is about, that they really haven't had a lot of cases of blood lead levels over 10 micrograms per deciliter, which is the threshold being used here. The DEP reference level is 5. So, but they only had 1.1% of the population who was tested, hitting between 5 and 9 in 2014. That is significantly different than here. Allison's slides, I know the animations didn't work, but we'll send them out afterward. I assume we can do that. We'll be able to share with you. There's some maps available on the county health department website right now that will show you the percentage of elevated blood level. We'll talk about that in a minute. So back to Longmont. So county has problems that are unique to their area though, and those are specifically radon, right? Not surprising in an area with all that mining, mold, and remediation of highly, this is sad but true, highly carcinogenic methamphetamine residue from laboratories and countless private homes where it was smoked. So that's kind of an issue in some of those communities, and maybe in yours or something similar. So they really got their city and county officials to work collaboratively and openly. And so what they have done is really try to use the actual architecture of their municipal offices to coordinate all kinds of resources in the same facility. They have tried to jointly train people. They have a rental licensing and inspection requirement in the city of Boulder to ensure no code violations. Longmont, which if you don't know is the second largest municipality in Boulder County, has a particularly low turnover rate that has enabled them to get their code enforcement officers to develop unique programming. So what they do is they reach out to property managers, and they're trying to create a sense of being on the same team. So they run joint trainings for the property managers and the code enforcement officials at the same time, which I know is not something that is typically done here, but again, perhaps an opportunity. Some of those trainings are on indoor air quality issues that both the inspectors and property owners would be interested in and be able to basically address. They strive to create an environment where no one is seen as the enemy. And they prosecute fraudulent essential maintenance practices certificates, or lead hazard noncompliance with hefty fines. So in a city where 80% of the homes represent a potential lead risk, teamwork has woven a tight net that makes it difficult for children to slip through, according to our research. Finally, as you see here, real estate agents as well can go through radon training, receive a Radon Smart certificate from the health department, and they can promote that on their website. So let's move on, talk about resources here. And I do want to comment before I get into these and say we recognize that you may not be able to specifically add things into building codes. And even for those of you who have rental registries, you may feel that some of your hands are tied. But flipping it around into more of a voluntary compliance opportunity or optional fields in the real estate transaction are well within your reach. Things are achievable today. If you could today say, I know that in 12 or 15 years, I can solve these problems in my community, I bet you'd be willing to do it. And so we want to encourage you to think about that. Some things that exist for you today, we already talked about the poster and the white paper that CCI have put out. I wanted to share with you, there's a URA program that the city of Pittsburgh offers, in case you're not aware of it, just as an example, that they are taking funding, offering 0% home emergency loan programs called HELP. They have a 0% Pittsburgh home remediation rehabilitation program. And that is also for energy efficiency. You could take that and focus on perhaps radon mitigation systems. It's a little bit over $1,000 to put in a radon mitigation system. It's not a cheap thing, particularly for somebody who, has limited means. But if you're able to use some of your public funds to create a revolving loan fund, I know that may be talking crazy to some of you who have very limited means. We understand that. But again, we're encouraging you to think about, how do you do this in a way that helps you to attack this. And that's why I noted the replacing the old lead lines program that is currently underway in the city with their water authority. So there's been an awful lot of attention on lead in water. One of the biggest risks still comes from lead paint in homes and soil in lots where properties have been demolished inappropriately, or they may have been a concentrated point source of lead, whether it was paint or some other industrial waste that was left behind in a lot. So there's an opportunity to really start looking at that in a systematic way. Potentially, if you haven't already reached out to your water authority, although I can't imagine that you haven't, given what's gone on in the news lately, but you should be collaborating with them and, as partners to look at how you address this. Let's go on to the next slide. Here's some other resources that exist for you today. Allegheny County Health Department runs a program, in case you're not aware of this, called the Safe and Healthy Home Program, where they offer inspections. That's not a complaint program, but it is a program that does a basic assessment. And as noted here on the slide, it is open to residents of not only Allegheny County, but also Beaver, Washington, and Westmoreland. They also have launched their Get Ahead of Lead program. And that is really the county's branding, the county health department's branding around their new outreach efforts on lead. As Allison noted earlier, the county published its task force report on lead in December. We did collaborate with each other. They were on our review committee, as were Action Housing and a number of other organizations regionally. So we really tried to take into consideration input from those who are in this community, as did the county health department. So you can download that report on their website, and I think it may be here as well. There's a contractor training is the last thing I want to let you know. That's actually on the next slide, so we're going to hold tight and talk about that. That's okay. But there are recommendations, which are pretty close to the ones that we've put out. A strong emphasis on the model they have really focused on is Rochester, New York. So I would encourage you to look at that as well. They've used a mix of building code and voluntary landlord engagement and rental registry and doing inspections every time a property turns over as an approach to really push ahead. Under the Get Ahead of Lead program, before I neglect to tell you, as most of you should know, testing is now required as of January this year for all children under the age of 2 in Allegheny County. It's mandatory blood lead level testing. By the way, that is free of charge to anybody who is on Medicaid. And the county, in addition, is offering testing sites, and those are detailed on their website, so that while you are not healthcare purveyors, you certainly can make sure that your residents are aware of this resource and this opportunity and the importance of it, because there's a significantly higher risk to children when they are younger, and in those early first 3 years of life, the developmental impact of lead poisoning can be much more deleterious and lasting. So we want to encourage you to help your residents to be aware of these resources and that there's a free opportunity, and there are sites across the county. Let's look at the next slide. So the County Economic Development Department has its own Lead Safe Homes program, which is funded through the through HUD, the Housing and Urban Development Department. And there's a link there on this slide. Through that program, houses can be remediated of lead, abated of lead, or taken to a lead safe level. They have funding to do about 150 homes across the county. Uptake was slow in the beginning. They launched this program last year, and there is still opportunity for residents to participate. There's a certain level of funding available per house. They will pay if needed to relocate those residents. There's a lot of detail out there. It is an income-based threshold. Some of those, income guidelines are listed there on this slide, but you can follow the link out to the County Economic Development Department website to learn more about that program. They are also aware that there may not be enough contractors who can perform the work. And I've heard this complaint from people at the various councils of government in the region that there aren't enough contractors to be able to do this remediation work. So the county has offered training to contractors free to become lead safe and lead remediation contractors, and that is a very involved process. So they're offering a introductory workshop on March 7th. It's noted here. Jennifer Sachs, whose email is noted there, asked me to please make sure you guys are aware of this. The brochure about it can be downloaded right now. It's up there. That's at no charge to those contractors. That's introductory session is actually 10 to noon. I have 9 there. That's just when they happen to reserve the room. But the session itself is 10 to noon, and a contractor could become, add that capacity. So if you find that you don't have enough providers in your community, or your providers think they can't do the work based on the budget that's available, I would encourage you to get them to come to this workshop, because I think there's a real desire to collaborate with local contractors and to build those businesses. Let's go on to the last slide. So here's just some high-level takeaways from what Allison and I have covered today. Right, these are really critical public health risks for your residents: lead, radon, and mold. And again, they are all preventable. Children's health is most significantly impacted. So we encourage you to really protect children as one of your priorities. Renters typically are most underserved, as you know. Protect them and children first. Policy changes can be made, despite what you may have, concern about, and they have successfully been made elsewhere. And that's what I hope we've highlighted for you here. They're really working with code enforcement, working with building codes, working with rental registries, looking creatively at how you handle fines and collaborate with other agencies who may not be your normal partners for collaboration, whether that's women, infants, and children's or your health agents. This full transition will take time, but planning, for a decade time span is probably a realistic thing, but you need to start and to focus resources where they're most needed in the short run. So you'll be able to get data as the county blood level testing unfolds. There are already maps available on the county health department website showing both where one of Allison's slide was buildings that are most affected, but there's also where there's the highest incidence of children. We know that I don't want to call out any particular municipalities, by the way, right now, but that data is available and has now been mapped and is going to be regularly refreshed by the county health department. So you should be aware of what the percentage is of children who are affected in your community, and focus your resources if it's down to a particular street or two, if it's properties who are owned by a specific landlord. There's your low-hanging fruit and your opportunity to try to engage them in making these productive changes for your residents. So I think that's probably where we're going to stop and open it up to any questions if people have questions. And thank you so much for taking time to listen to this today.
Great. We have some questions coming in right now. While we sort through those, there were just another couple of things that we wanted to mention. In case you want to have a set of resources that you can post on your website, what we would suggest as a starting point is to link people to our advocacy page. And we have the link up in the slideshow that is getenergysmarter.org/advocacy. We do have a list of resources available for you there. So that's a good starting point.
And also, the Children's Health Network has a list of children's health indicators that they publish and have just refreshed recently. And locally, Women for a Healthy Environment, a fellow nonprofit, is convening a group, and we're working with them. It's called Get the Lead Out Pittsburgh. They have a new website up, and they'll be posting a number of resources there. We'll be linking to it on our website, and you'll be able to find it that way as well.
One question related to that is, will this webinar be emailed to us and that we can share with others? And the short answer is yes.
Yes. Yes.
I don't know if they probably can't hear me.
Oh, okay. So one of the questions was, will this webinar be emailed out to participants, viewers today? The answer is yes.
And we're going to provide names and emails.
And we will
Yes.
provide contact information for the people, for ourselves, and the other resources mentioned in the slides.
Does the PA Uniform Construction Code require radon-resistant construction, or do the municipalities need to add it?
I don't know the answer for certain, and I was actually in the PA construction code trying to determine from the online tool, which is not the easiest thing to navigate, as some of you know, and we don't happen to have a hard copy that's current in our office, so one of the things we're going to fix. But our understanding is that no, it is not required, except for new construction. Typically, the practice is in new construction that people do it, but you could require it in your municipality. And also for major retrofits, when people are taking out a building permit, for example, it's not that difficult to retrofit in a radon mitigation system.
And apparently they can't hear me. So thank you, Miriam.
Hi, Miriam.
Are there actions that residents can lead aside from advocating for their local government? Meaning, what can a neighborhood do in the immediate? Thank you.
Some of what we've seen as far as success stories in other cities is community-based organizations, neighborhood groups, and this is part of what we've harnessed in Grassroots Green Homes, is being able to provide a venue to bring experts in to talk about issues and provide resources or assistance if that's available. What we've been able to do in Grassroots Green Homes is leverage with our expertise, being aware of some of the assistance programs that are available and some grant funding that's available, being able to tie those things together, and through the funnel of a community-based organization that has roots in a network in its community, being able to connect the residents of the community with those resources. So I would say the first step is contacting organizations that you know do this work, like ourselves, and if we can't do it, we can point you in the right direction. But also just building your network within your community so you know who is really concerned about these issues, and honestly, it should be everybody. But knowing whom to tap, whether it's an individual, whether it's an organization, and then connecting with other organizations that can help there.
Yeah, we are happy to come out and present at your municipal office to community meetings for whatever group makes sense to highlight these issues. I mentioned that Burlington was able to get EPA grants to pass out radon kits. January is Radon Awareness Month, so we're past that. But if you plan in your municipal cycle, if you have community health fairs, these are the kinds of things you could be highlighting. The other sort of thing that you can do is just simple awareness. I didn't talk much about it, but one of the communities, I believe it was Burlington, had flyers everywhere in their public libraries,
in cafes.
Offices. Yeah, so public places put up informative tools. And again, we're working to create better resources. There's a ton of great stuff on the EPA website that you can link to through our website that if you simply even have the wherewithal to print those and pass them out to heighten awareness, that's one thing that you can start doing and people can do in their own community.
One other question was, we represent an audience that is not just Allegheny County. We have the 10-county region of Southwest Pennsylvania. Are you open to going and presenting in municipalities outside of Allegheny County? And are there opportunities with those counties as well?
The answer to both is yes, absolutely. I mean, these are regional issues. Our research happened to focus primarily on Allegheny County. I'm sure you caught that even the Allegheny County Health Department program serves other counties that are adjacent, not all 10. These housing stock related problems, I mean, again, if you go back to what I said in the beginning, we're looking to create homes that live better and last better for everybody. And I know that's really what you want for your residents too. That's the kind of housing stock that increases, home value, longevity of residents, all the good things that you're looking for, in your stewardship of your communities. So yeah, these same things, I may not have all the data, and there may not be the same kinds of programs as resources. That's the one downside, but we're more than happy to work with you. So thanks.
Any others? Okay, it looks like that's all the questions for today. So I'd like to thank everybody for joining us, and thank you, Allison and Janine, for participating. We really appreciate it. It was great. And just a quick reminder, I'm not going to jump in front of the screens that you guys are still there, but April 3rd, the Call Your event, please join us. And next month, we're going to be talking about age-friendly communities. And again, we're going to send out a reminder email with all this information probably as soon as the end of this week. Yeah. All right, great. And thank you, Justin, for handling all the technical data. See ya.
Thank you.
Thank you.
Thanks, everybody.
Thank you so much.